Hi guys, welcome back to my channel. Today we're talking about urinary tract infections, or UTIs as we commonly call them. Something that most of us, or at least some of us, are familiar with, right? Maybe you've been fortunate enough to have never experienced it, but you've heard about it. So we're going to talk about the symptoms, the causes, and we're going to highlight some home remedies that you can use to help to prevent you from getting a urinary tract infection. Urinary tract infection, or UTI, is basically, for the most part, a bacterial infection of the urinary tract or the urinary system. And I say for the most part because rarely you can have a fungal infection resulting in a urinary tract infection. So for the most part, it's a bacterial infection of any part of the urinary system, and the urinary system is comprised of the kidneys, the ureter, the bladder, and the urethra. So an infection, bacterial infection of either of those organs is what we call a urinary tract infection. If the infection occurs in the kidneys or the ureter, then we say that it's an upper urinary tract infection. However, if the infection occurs in the bladder or the urethra, then we can say that it's a lower urinary tract infection. Women are more likely to have a urinary tract infection, and this is basically because of the anatomy of the woman. So the woman's urethra is way shorter than that of the male's urethra, and not only that, because the female's urethra is in such close proximity to the anal opening, and this is why we stress, wiping from front to back, always front to back, right? Before I jump into the symptoms, I want to point out that you can have, bacteria in your urinary tract and not have any symptoms. When this happens, we say that it's asymptomatic. You can have bacteria there and you not have any symptoms, and this is usually seen like if you do a screen or a urinalysis, right? Because it's there, you're not having any symptoms, so you're not suspecting it, right? If the infection occurs along the urethra, then we can be more specific and we say that it's urethritis. If the infection occurs in the bladder, we can be more specific and we say that it's cystitis. If the infection progresses and, unfortunately the kidneys become infected, we can say that it's pyelonephritis. And depending on what part of the urinary system becomes infected, the symptoms will be a little different, right? So you can use the symptom to determine which part of the urinary system is infected, because the symptoms, they're a little bit different, right? Symptoms can be very annoying, they can be very, it interrupts your daily activities and ultimately reduces your quality of life, right? So a lot of persons will experience pain or burning when passing their urine, and we call this dysuria. This is usually seen with urethritis, when the urethra is infected. Other symptoms may include, frequency. So there's an increased frequency to pass your urine, right? And this usually happens more at nights, and we call it nocturia. So like every minute you have to get up and go bathroom, go pass the urine. Yeah, so nocturia, or frequent urination at nights. Another symptom you can experience is urgency. So you feel this urge and you just have to drop everything and run. So urgency, that is another symptom, right? Another symptom you can experience is post-void dribbling. So you go to the bathroom and like shortly after you have some residual urine that didn't come out, and it's so annoying and it's so uncomfortable, right? You can also have difficulty initiating the urine and also to maintain the urine stream. So that's another symptom, difficulty initiating the urine. So you go to the bathroom and you're sitting there on the toilet and you're there for like 5-10 minutes before the urine actually starts to come out, and when it do come out, it's hard for you to maintain that urine stream, right? So difficulty initiating the urine and maintaining the urine stream. Those are typically symptoms of urethritis. You can also have cloudy urine, right? That's another symptom typical when you have a urethritis. If it's left untreated and then it progresses and unfortunately the kidneys become infected, then you start to have flank pain, and this can be on one or both sides of the body, right? So you can have flank pain, fever, right? When we start to have fever, then we know it's serious. There also can be blood in the urine, but usually this is not something that you see with the naked eyes. Usually that's something that you see under a microscope. We say that's hematuria, right? When there's blood in the urine. You can have a foul smelling urine, and this is basically because of the presence of the bacteria that is there. So the bacteria, you know, the waste from the bacteria cause the urine to have a foul smelling odor, right? So there are several symptoms that you may experience with urinary tract infection. Let me go over them. We have urinary hesitation or difficulty initiating the urine and maintaining the urine stream. We have urgency, so you feel like you have to drop everything and run. We have frequency, which is more common at night, and we say that's nocturia. We have pain or burning sensation when passing the urine, and we say that's dysuria. You can have cloudy looking urine, foul smelling urine, all of that. Now we're going to talk about some home remedies that you can practice to prevent you from getting a urinary tract infection. The first one is, drinking lots of water. So drinking plenty water will help to wash out the bacteria and help to prevent you from getting a urinary tract infection, right? So drinking plenty water helps to flush out the bladder and all that good stuff. Another thing that you can do to help to prevent you from getting a urinary tract infection is to empty the bladder when you feel the need to, right? So emptying the bladder on time is another good practice that you can use. Avoid douching, right? Females avoid douching. Tired for say this? No, right? Some forms of contraceptives also increases your risk of getting a urinary tract infection. For example, spermicides, diaphragms. So if you can use alternative methods like a condom, that would help, right? Yogurt, cranberry juice, cranberry supplement, or whatever you can get. But cranberry juice, yogurt contains lactobacillus acidophilus, and it also contains bifidobacterium, which are good bacteria, right? So those are good bacteria. So yogurt and probiotics, right? Those will help. Practice peeing immediately after sex, right? That will help to wash out any bacteria that would have been introduced during sexual intercourse, right? So drinking lots of water, peeing immediately after sexual intercourse. Another one that I missed, vitamin C, right? Remember, vitamin C is acidic. We want the vagina and the urinary tract. We want the urinary tract to be a little acidic because the bacteria cannot survive in that acidic environment. It's not ideal for the bacteria to strive. So vitamin C makes your urine acidic, and this helps to prevent you from getting a urinary tract infection. Also grapes, right? Grapes, that's another good acidic food to have. I think I've said it. I mean, there are others, but those are just some of the practices that you can, those are some of the good practices that you can use to help to prevent you from getting a urinary tract. When those don't work, then you're gonna need antibiotics to clear up the infection. Once you get rid of the infection, then you can try to use those to help to prevent a recurrent infection, right? I hope you guys learned from this video, and like, comment, share all of them excitement. See you in the next video.